Hi, I'm Dr. Michael Ford. I'm an endodontist here in Central Texas. We're in Harker Heights. We're about an hour north of Austin. And as an endodontist, this is all we do exclusively is root canals and root canal related problems. If you've reviewed some of the other videos, you know the cool thing about this gentle wave procedure that we're using now. And it's a phenomenal shift in the way we do root canals. It's also a phenomenal shift in after your root canal. So what happens afterwards? Well, 99% of the time, you're just doing great. 1 to 2% of the time, you can have some problems. And we like to always alert you so you know what those problems are. At the end of every procedure, we review what we refer to as postoperative instructions, or what to watch out for after your root canal. So this all comes out in a little trifold pamphlet. This is what it looks like. It speaks to the things that are very, very important that you do, that you're sure to do afterwards. One of the first things we recommend is that before all the numbness wears off, that you take something for the pain. We generally recommend a non-steroidal anti-inflammatory because after the procedure, pushing, wiggling on your tooth a little bit, it's inflamed, often much less than kiddos having braces adjusted now. The old-fashioned procedures we were using prior to this, it could be fairly tender for 2 or 3 days afterwards. We would prescribe, in the past, we would prescribe 5 prescription strength Motrin for you to take every 6 hours, along perhaps with even some Tylenol in between. Now with the gentle wave procedure, we found that 3 of those are more than enough. Most folks take the first one that we kind of push on you here in the office. Please take something. And lots of times folks are reporting they don't take anything else afterwards. So that's one of the very important things to do so that as the numbness goes away, it's an easy transition into that. Sometimes your gums can be tender. We put a little cover on over top of the tooth called a rubber dam or a dental dam. That prevents any contamination from getting in, prevents all the nasty stuff that we're taking out of your tooth from getting into your mouth. You don't breathe it, you don't swallow it. Sometimes your gums can be a little tender around the tooth where that's kind of held on. So that's one of the things we talk about too. A nice warm salt water mouth rinse to help with that. We also talk about maybe stiff jaw muscles or soreness. Sometimes these procedures take 35 to 40 minutes to be finished up. It's kind of a long time to hold open, and your jaw muscles can sometimes be tired from that. We always talk about too whether or not your tooth is tender when you put your teeth together. Now, almost always when your tooth does not have a crown on it, we shave the tooth down a bit so that when you put your teeth together, you don't bump into it. That makes it feel better faster. But sometimes inflammation from underneath a tooth, or if your tooth already has a crown on it, you may be bumping into it. Sometimes your bite needs to be adjusted afterwards. So we talk about that too. Also, if your tooth does not have a crown, very important that you do not, must not, should not, do not bite or chew on that tooth at all until you have a crown with your general dentist. The tooth can be susceptible to cracking or breaking, especially if you're actively chewing on it. It's usually not an eggshell, but you do want to stay away from it until it's protected by your general dentist. We recommend you get in there just as soon as they're able to get you in, but certainly no later than 4 weeks after the procedure. Sometimes there's a temporary filling in over the top that can weaken or begin to loosen up. If we place a permanent filling for you, you don't necessarily have to worry about that's not going to come loose at all, nor is your root canal going to get reinfected at all. It's permanently sealed. But some of the docs prefer to put that in themselves. That's fine. I did general dentistry for 7 years. I know sometimes you'll like to see what the inside of the tooth looks like before it's restored, and that's great. So either way works fine. We just always let you know what's in your tooth so that you know how to most quickly and most expediently proceed. And then we also talk about some of the things that can happen if your root canal would perchance get reinfected if you don't get in right away or the temporary seal comes loose. So very, very comprehensive follow-up with this. We also discuss with you the medication strategies. And of course, the very important thing of our phone numbers. How do you get a hold of us afterwards? So if you have any questions afterwards. So those things are all very important. That's all covered in our pamphlet. And as I would recommend that you, of course, follow the instructions that we give you. You'll find a transition after a root canal to be fairly straightforward. The gentle wave procedure, though, has made a huge effect in the way that folks are reacting afterwards. Because the tooth is so much cleaner, it's actually removing some of the stuff from underneath your tooth that was a source of infection and inflammation for you. Check that out at gentlewavetexas.com. That's gentlewave, Texas, Texas, all one word, .com. You can call our office at 254-554-3636. Thank you so much.